Hello, welcome to vlmd Rounds, a podcast on medical science and tools to optimize your health. I am Dr. Vyvyane Loh. I am board certified in internal medicine and obesity medicine, and my interest is on metabolic health to reverse chronic diseases or prevent them in patients. Now, because I treat a lot of obesity, oftentimes when patients come to see me, I get asked, Dr. Loh, what do you think is my goal weight? What's the ideal weight for me? And I would always look at them and say, I really don't know. And I think they're a little startled to hear that from an obesity doctor. But it's not just the patients that fixate on that number on the scale. Healthcare providers do that also. I have a close friend from medical school. She is very bright. She's a very good doctor. And she knows not to focus on that number on that scale, but she still can't help it. And she said to me many times, Vyvyane, I know it's not the number on the scale. I know I shouldn't fixate on my BMI, but I just want a normal BMI. I just want to be in the normal category for BMI. So, I'll worry about the other stuff that you talk about all the time later, but just let me get to that ideal weight and that ideal BMI first. So I thought that I would spend this episode talking about body composition, because that's way more important than the number on the scale. That's way more important than your BMI. And really, your body composition tells me what you're made of, right? What is constituting that weight, that number that you see on the scale. So yes, today's episode is going to be on body composition. Let's go. Let's start with BMI, and that stands for Body Mass Index. What the BMI is your weight divided by your height squared, the square of your height. And these are all in metric units. So you have to use kilograms for your weight and meters squared for the height squared, all right? And so if you take your weight over height squared in metric units, then you will get a number that is known as your body mass index, or BMI. And what's important about the BMI for most people is that there is a table, and this table categorizes you depending on where that number falls. So for example, if you have a BMI from 25 to 29.9, if it falls anywhere in that range, then you would be classified as being overweight. If that number is 30 to 34.9 in that range, then you would be classified as having class 1 obesity. If the number is 35 to 39.9, then you are classified as class 2 obesity. And if it is 40 and above, then that would be class 3 obesity. All right, sounds very cut and dried, easy, except you really can't look at the BMI and know a lot about an individual patient. It's a good population index tool, so we can look at large populations, and it's good for public health and those situations. But as a clinician treating patients on an individual basis, it's really not very helpful. For one thing, there are differences in those categories depending on your ethnicity. So I get patients who are from South Asia, from India, for example, and they will come to me and they'll say, well, Dr. Loh, I know I should eat better and I should take better care of myself, but it's not so bad because my BMI is 26, so yeah, I'm a little bit overweight, but it's not like I'm obese or anything. Except that they are. Because if you're South Indian, if you're South Asian, if you're Indian from India, then a BMI of 25 would put you in the obese category, right? I am East Asian, and therefore when someone of East Asian heritage has a BMI of 27, that would put them in the obese category. So we're really going to have to look at different ethnicities. Now, if I have a patient who is of African American descent, then I would rather that they have a slightly higher BMI. I would prefer them to have a BMI of maybe 27 because they tend to have higher lean mass. And you really don't want to mess with that. You don't want to decrease their lean mass. So the BMI can be helpful, but when we're looking at individuals and when you're treating individuals, it really doesn't give you a whole lot of information, which is why I don't rely on the BMI. Instead, what I rely on, what I like to look at, is the body composition. And I want to know how much of your weight comes from fat, for example, and how much of it comes from lean mass. That's what you mean by body composition. So if someone gives me a number on the scale, all right, it's a number. How much of that is fat mass? How much of that weight is just from fat alone, right? So if someone is 100, let's say 200 pounds, just to keep an easy number, 200 pounds and they are 50% body fat, then really 100 pounds would be coming from the weight of the fat alone. Right? That's what it means when we are looking at the percent body fat. Rather than use the BMI, I'd much rather look at that number, the percent body fat. Now we have different criteria to define obesity using percent body fat. It can range. So some institutions can be a lot stricter and use a lower number, but there is a range for both males and females. For men, that range would be roughly from 22% to 25%, right? If you exceed that range, then you would be classified as being obese regardless of your weight. We don't care if it's a normal weight or not. We just want to know how much of your weight comes from fat. And if the percent is 22 to 25% in a male, then likely you are hovering on obesity. I tend to be more generous. I take the higher number as the limit. So I will say if you're a man, then anything 25% body fat or higher would put you in the obese category. For women, that range is from 30% to 35%. And again, I tend to be more generous and I use the higher number, 35%. So as a woman, if your percent body fat is 35% or higher, that would put you in the obese category. And it's really important to look at the percent body fat because as I told you earlier, and I'll show you now, the weight or the BMI can be highly deceiving. So there was a study done in 2014 by Lorenzo et al. And this looked at a population of Italian women between the ages of 30 and 40. And if we went just by the BMI alone, 30% of the women were classified as obese. So about 1/3 of them. But when we looked at the percent body fat criteria, and they used that 35% number. So if they use the 35% cutoff, then it turned out that 82% of that same population was now classified as obese. So we went from 1/3 to pretty much everybody, right? Big, big difference. So that was the Italian study. We also have a study, if we look at NHANES 3, this was done between 1988 and 1994. And in NHANES 3, they looked at about 13,600 patients. And by BMI, 21% of men in that population and 30% of women were classified as obese. All right, so okay, not bad, except that when we looked at percent body fat, again using 25% cutoff for men, 35% cutoff for women, then we went to 50% of the men were obese and something like 60% of the women were obese. Okay, now I want you to think carefully because this was back in the period of 1988 to 1994. And the prevalence of obesity by BMI has skyrocketed since, right? 2018 numbers put it at 42% prevalence in the American population. And it's gone maybe a little bit higher after COVID, so maybe we're hovering between 42 to 45%, let's just say, by BMI. What do you think that percent would be if we looked at percent body fat instead of the BMI? I'm going to let you think about that one. Now that you know that body composition is so important, how do we go about measuring it, right? How do we know our body composition? Well, interestingly, sometime earlier this year, I got a phone call from a radiologist, and he's from a large multi-specialty clinic in Texas. And he called me because they had just started using a machine called the DEXA to evaluate body composition. And he called because he felt that something was wrong with the machine. And since I'd been using the DEXA for a very long time, he thought he'd check in with me. So he said, yeah, I know you've had a lot of experience with the DEXA, and I wondered if you could help me out with this. We would measure the body composition, the percent body fat of our patients using another tool before, and then we acquired this DEXA machine and we started using it on patients, and it's wildly inaccurate. It's completely off, and no matter what we do to adjust, we can't get those numbers to sync. And so what's the deal here? Now let's look at the various ways to measure body composition. The gold standard would be CT or MRI, all right? So with a CT scanner, we can essentially measure your body composition very accurately. The problem is that CT is expensive. It's hard to access, right? Someone has to place an order for you to go to a center that has a CT scanner, and then you have to get that. And there's exposure to radiation. So one CT could be the equivalent of something like 700 X-rays. So that's a lot of radiation, which means that, well, you could get one CT, but you can't really think of following a person's body composition as it changes, as you make adjustments in their treatment plan. You can't follow it with CT because you would be exposing the patient to a lot of radiation. So that's a big disadvantage, right? You could use MRI as well, but that is also very expensive and it's very time consuming. If you've ever had an MRI, you seem to lie there forever. And if you're claustrophobic, that is not a good option, right? And so it's a big to-do just to get one MRI. Again, not so easy to have sequential MRIs to follow the progression of someone's body composition as you treat them. So while they are great and very accurate, they're not really practical tools that you can use for looking at body composition. Now, there are a number of devices, and some of them use Archimedes' principle of displacement to give you an assessment of your percent body fat. So whether you displace water or you displace air, it's the same principle. And those are not too bad. They're fairly accurate for measuring percent body fat. But perhaps the most common method that I see when patients come to me is something called bioimpedance. So bioimpedance, essentially, if you've ever gone to the gym, a lot of the personal trainers like to use this device, and it tends to be this handheld device. You hang on to what looks like handlebars, and it spits out a number at you and tells you your percent body fat. And the idea is that fat is really a poor conductor of electricity, while lean mass is a great conductor of electricity because it contains water and electrolytes, right? So electric current can pass through that easily. And what we're really measuring is the resistance of the body to a small alternating current that you pass through the body. And that gives you approximation of the fat-free mass in the body. Now, the ones where you have the electrodes on the feet and the hands, those are a little bit more accurate, but the ones that are most common are the ones I talked about, the ones at the gym, when you just the hands, right? And those are really not accurate at all. It's also very dependent on hydration status. So if you just drank a lot of water, you have a full bladder, you didn't go to the bathroom, you ate lunch, or you had a protein shake, something like that, then it's going to be wildly off. And that was what the radiologist was noticing, because they were primarily using bioimpedance before they got their DEXA scanner. And so they had these numbers that gave them a certain percentage of body fat, and then when they switched to the DEXA, which is a kind of X-ray machine, the numbers were wildly different. So while DEXA is an X-ray machine, it is really a very low radiation risk. I think the exposure is similar to 1 day's ambient radiation. If you were to get on an airplane and fly from the East Coast to the West Coast, that flight alone would expose you to about 1 week's ambient radiation. So those of you who are frequent flyers, you get a whole lot more radiation just from flying. You're only exposed to 1 day's ambient radiation with the DEXA machine, which is why it is safe to use even in children. And I've certainly done body composition analyses in the pediatric population as well. The other thing about that is it is highly correlated to CT. So it's been shown, and they've done studies, and what we see in terms of body composition from DEXA results is well correlated to CT studies. So we know it is reliable, and in fact, most academic centers, if they're doing research, are using DEXA because it's more accurate. And I told you the radiation risk is very low. Therefore, we can follow someone sequentially over time. So if you have an intervention, you tweak your treatment plan, and you want to see the results in terms of body composition on a patient, you can scan them 2 weeks later, you can scan them, a few days later. It really isn't going to cause any high risk to radiation exposure. So it's very useful clinically in that sense. And that's what we use. We primarily use DEXA to evaluate body composition in our patients. So back to that radiologist, I told him that, it turns out that he did use that bioimpedance device prior to getting the DEXA, and I told him, you're better off, you really should trust the DEXA numbers. They are accurate, right? In fact, I have a little trick that I do, and I have just kind of tested this out. There's no study that proves this. This is not based on any data that's out there. It's purely based on my own experience, but really, I have never been wrong. I've never been wrong. If a patient comes to me and tells me that they had their percent body fat measured using those handheld bioimpedance devices at the gym, I will make a mental adjustment in my head, and I will kind of guess before I put them in my own DEXA scanner to see what that percent body fat will be. And I have never been wrong. So here's the little trick. Again, please, it's not based on any data. It's just based on my years of experience in treating patients, right? So if the person is a man and he tells me a number, then I'm going to add about 10 to 15% on top of the number he tells me. So let's say he tells me that he's 10% body fat. Then I'll do the eyeball test, right? And depending on whether he's on the leaner side or not, I'll make an adjustment, and I'm going to say, okay, 10% body fat. He's anywhere between 20 to 25 by DEXA. That's for a man. Now, if it's a woman, then I make a different adjustment. So a woman comes to me and she says she is a certain number. I actually add 15 to 25% to the number. So if the woman says she's 10% body fat, then she's going to be, based on my eyeball test, I'm going to guess between 25 to 35% body fat. And that's a big difference, right? She's thinking she's 10% body fat. And really, when we DEX her, she's going to come out close to 35% body fat, which is really where obesity starts. And we go from very lean to really at the obesity level. And that's why it's important to get accurate measurements. So I shared these numbers with the radiologist, and he just said, oh my God, that's exactly what we're noticing, that there is this, 10 to 15 point difference, and yeah, it's more in women. I was like, well, yeah, I've been doing this for a long time. So I make the adjustments in my head. Now, the bad news is you tell that to patients and they're not very happy at all. They really want to cling to the lower number, even though it may not actually be healthier. And we can talk about that later. So that lower number may not actually be better, but they will cling to it. Maybe it's vanity, maybe, I don't know. But, no matter what you tell them, and when they see the actual DEXA report, guess what they're thinking? This has to be wrong. Nah. And they would much rather believe the other number, the lower number, right? But they're wrong. Yeah, too bad. So why am I so interested in that percent body fat number? Because that is going to tell me about the patient's risk, cardiometabolic risk, right? And this is very useful information. Remember, my focus is on reversing or preventing disease in the first place. And you may think you're fine, but if I see signs that tell me, we're headed towards trouble, then if I can warn you ahead of time and we can make some adjustments, we can prevent bad things from happening, hopefully, right? A lot of the times we can. So with a normal body weight, which again is what most people fixate on, you can still have high risk for cardiometabolic diseases such as hypertension, heart disease, strokes, diabetes, right? So it doesn't matter what your weight is. And in fact, the pity is that we focus on a number on the scale or the BMI, and if someone is normal weight, we assume that they are healthy, and they may not be based on body composition. So I have a few studies here that I want to talk to you about. This first one is from JAMA Oncology 2019, and I'll provide the links, and you can look that up on the website vlmdrounds.com as well. And it basically, the title is Association of Body Fat and Risk of Breast Cancer in Postmenopausal Women with Normal Body Mass Index. I emphasize normal BMI. So again, we are seeing higher risk for invasive breast cancer, even though the weight appears to be normal, right? I'm going to read from the study. Specifically, we found a 56% increase in the risk of developing estrogen receptor positive breast cancer per 5 kilo increase in trunk fat despite a normal BMI, and this association could not be explained by a rise in BMI into the overweight or obese range. So that percent body fat can put you at higher risk for breast cancer, not just breast cancer. Here's another one, which says, the title is the association of body fat composition with risk of breast, endometrial, ovarian, and colorectal cancers among normal weight participants in the UK Biobank. Right? This is from British Journal of Cancer. And they're saying that it doesn't matter, same thing, what your weight is. In fact, they're looking at normal weight participants. But if you have high body fat composition, then you're at high risk for breast, endometrial, ovarian, colorectal cancers. And here's one more. This is from Nature, and the title is Central Body Fatness is a Stronger Predictor of Cancer Risk Than Overall Body Size. Right? So that's why it's really important to focus on your body composition, and you really want to know with accuracy your percent body fat. Because if we go back to the example that I gave, the woman who went to the gym and used a bioimpedance device and thought that she is 10% body fat, when in actuality she's at 35% body fat, or you know, more commonly 15% body fat. That would put her maybe in 40% body fat range. All right, this person has high risk for breast cancer, invasive breast cancer, endometrial cancer, ovarian cancer, colorectal cancer, right? And she thinks she's fine because she thinks she has a low percent body fat because of that inaccurate measurement, right? So that's why it's important to know your real body composition. And I highly advise people to get a DEXA body comp and talk to your doctors about body composition rather than an ideal weight or BMI. Now, where can you get a DEXA? It's really not that hard because the DEXA is used in most hospitals and medical facilities to measure bone density. So if you've ever had a bone density test, they're using the DEXA machine anyway. You can use that same machine to measure body composition. It's just that not many people do it. Not many people think of using it for that. And also when they see the results, they don't quite know how to interpret it. So you can ask your doctor. If they don't use DEXA to do body composition and you are in Massachusetts, then you can call my practice and we do DEXAs for body composition. And even if you are out of state, just give us a call and we will find a place for you where you can get your body composition by DEXA. You can see why it's really important. And it's not just for cancers. It also will tell you about your risk for heart disease. It will tell you about your risk for high blood pressure, strokes, all those things, diabetes that I told you about earlier. Now, if we go back to what I said earlier, those studies that I referenced, where when we looked at a population by BMI, right, we had a certain percentage of that population be classified as obese. But when we looked at percent body fat, it was a much higher number, right? I want to bring you back to those numbers I talked about in terms of prevalence of obesity by BMI in America. 42 to 45%, let's say, prevalence of obesity. Right. If we go by percent body fat, what do you think that number would be? That's what I asked you earlier. I'll tell you what I think. Again, I don't have the numbers to prove it, but it's again based on my experience. I think we are closer to 90%, above 90% of the American population has obesity by percent body fat. I think I'm going to let that sink in a bit. This means that if you walk into a room of 10 people, 9 out of the 10 will have obesity by percent body fat, regardless of weight. You eyeball them and they look normal. I can't tell you how many patients I've seen with normal weight. They look thin. They look normal weight. They come in I do a DEXA and they are 50% body fat, 60% body fat even, right? You'll be amazed. And they are shocked. So forget that 40% number, 42 to 45% number. We're closer to 90% of the US population has obesity by percent body fat. Now, at the end of 2018, Gilling School of Global Health came out with a study that said that only 12% of the American public is metabolically healthy. And then a more recent study came out this year from Tufts School of Nutrition, and according to them, 7% of the American public is metabolically healthy, right? Only 7%. Now, that's not proof, but it certainly goes with the idea that roughly 90% of the population probably has obesity by percent body fat. That is really mind-boggling. And I don't think we've actually been able to look at those numbers and take that in and, understand that. 90% of the population. Those people you think are skinny, if I put them in the DEXA, yeah, a lot of them would have obesity by percent body fat. So I think this is a good thing to consider because a lot of my patients experience a lot of stigma. Obesity, usually people think of as something that is perceived visually. So you can look at someone and you can make the assumption that someone has obesity. And now what we're realizing is you can look thin, you can look a certain way, and you could still have obesity, right? So it really makes us rethink our concepts of what is healthy and what is not healthy. We often go by looks, and looks are really deceiving. Another thing I want to add about body composition relates to aging. As we age, our body composition tends to change, and we tend to gain more fat and lose muscle. Now, we may actually stay the same weight, but your body composition is changing despite maintaining a certain weight. So if you imagine someone who is, let's say, 150 pounds, and she postmenopausally, she loses 5 pounds of muscle but gains 5 pounds of fat. If she steps on the scale, what's her weight? 150 pounds. It didn't change, but her body composition has changed drastically, right? So that means her risk for cardiometabolic disease has also changed, but we're not going to recognize it simply because we looked at that number on the scale and it's the same. No problem. You're doing well, Mrs. Smith. No, you're not. All right. So with aging, it's particularly important to follow your body composition over time, maybe at least once a year, get your body composition done to see how you're doing, to see that you're maintaining lean mass and not gaining fat mass. There are also various disease states whereby I think it would be good for someone to do regular body compositions. This would be if they had heart disease or specific lung diseases or cancer, because we can have changes in body composition that would give a poor prognosis in terms of morbidity and mortality for those patients. If we looked at the body composition, we can predict ahead of time and maybe intervene to try to prevent those poor outcomes, right? So we'll probably talk about that in later episodes. All right, so now time to wrap up and have a little summary. Today we talked specifically about body composition. We started with BMI, body mass index, which is weight over height squared in metric units. And we talked about how that's not really useful in treating the individual. Instead, we should be looking at body composition which tells us how much of your weight comes from fat. This would give us an idea of your percent body fat. It's important to know this with accuracy because it is a predictor of your risk for cardiometabolic diseases like heart disease and high blood pressure, and also for cancer. And as you're aging, you also, if you want to age well, you want to preserve your body composition with low percent body fat and higher lean mass, because you will do better and age better and have a better health span if you do that. In order for you to measure your body composition with accuracy, you really should try to get a DEXA body comp done, and you can talk to your healthcare providers to see if you can get that done. If you're having trouble, contact us and we'll try to help you set up a body comp by DEXA. Right. The other thing is, if you've gotten that body composition, you don't want you to just stop there. You want to follow the progression of your body composition. So over time, say you have a high percent body fat and you work with your healthcare provider and you come up with a treatment plan to improve your body composition, then you should be following sequentially that body comp to see objectively if you're getting results, right? Is the percent body fat going down? Is the lean mass going up? And if not, then you'll have to tweak something in your regimen, right? Because the radiation is so low, DEXAs are really good for following the progression of your body composition. All right, I hope that today's episode was helpful. We are going to dive deeper into body composition in further episodes, and I will talk not just about the percent body fat, but about where the fat is found and how that impacts your health. But for today, this is Dr. Vyvyane Loh signing out from vlmd rounds, and I sing the body electric.